And now we have a whole healthcare segment, access to healthcare. What has happened in terms of COVID? Where are we? Where are we trying to go? What do we need to do? Are we opening up completely? What should we do? How many people have been tested? Well, we have our own health commission. It's headed by Dr. Leon McDougle, who is president of the National Medical Association, the largest association of African American doctors in the world. Dr. McDougle will share with you elements of our health manifesto. Dr. Debra Furr-Holden, immunologist, a tremendous person. She's at the University of Michigan. Those two will give us the elements of our manifesto. We'll talk about health inequities and what we as a people must do to provide not only for African Americans, but really how do we deal with making health more accessible and better for those who are living on the margins of life.
On behalf of the Rainbow Push Coalition, I'd like to welcome you to a candid COVID conversation with Dr. Leon McDougle and Dr. Debra Furr-Holden. I'm your moderator today, Yvonne Lewis. I am the founder and founding director of the National Center for African American Health Consciousness. The Rainbow Push Coalition joins with the National Center to bring you this very special conversation today. There's a lot that's going on around with COVID in these last few months, and along with the president of the National Medical Association, Dr. Leon McDougle, and the Associate Dean for Public Health Integration at Michigan State University, Dr. Debra Furr-Holden, we have some good information for you here today. Dr. McDougle, let's start this conversation off with you. You've done a lot of work around COVID, as we heard in your bio, but please tell us and speak to us about public health, the Public Health Manifesto, and what's happening with the task forces that you serve on.
Thank you so much, Director Lewis, for serving as moderator. And so to start, just want to speak to the importance of the Rainbow Push Coalition and Reverend Jesse L. Jackson Sr. and convening leaders across the country to speak to this most important time that we are in. I reflect back to last March of 2020, and Dr. Furr-Holden and the RPC staff, we were meeting, and Reverend Jackson said, we need a 10-point plan and we need a manifesto. And so we worked together to put together that manifesto that in fact was published on April 15th, and it's recorded or published on the Rainbow Push Coalition website. And we expanded that 10-point plan to a 12-point plan to include Africa and to include workforce diversity. And we were speaking to issues of the time and are of that time now. So we talked about physical distancing. We talked about the importance of wearing a mask. We talked about the importance of washing hands. And then at that time, Director Lewis, there was a big concern about having access to diagnostic testing. And we would see these lines of SUVs rolling up to get the diagnostic testing. And we spoke to the fact that, well, what if you don't own an SUV? So we advocated for having walk-up centers for testing wherever these drive-in centers for testing were located, and that they be within walking distance of a source of public transportation. And now that's present here today when we talk about vaccine access and being in places where the community can receive vaccinations. And I know that's an issue now, and we're really advocating for vaccine availability and usual sources of care. So more so moving to that person's office of primary care, and as the age continues to descend for having approval for the vaccine, it looks as though now with the Pfizer vaccine, there's approval to age 12, and that's going to continue to descend as information comes back on these clinical trials, and it's anticipated that this will continue down to 2 months of age. So that's a process, and I know with the concerns about opening schools and safety in schools, so now it's middle school essentially and up that are able to get these vaccines. So and so I've just stopped there for now, but there's a lot that the manifesto continues to speak to in this time we are in now.
Thank you, Dr. McDougle and Dr. Furr-Holden, because when you talk about vaccine availability, at one point we could hardly get vaccines in our community. Now we have an overabundance, well, I shouldn't say an overabundance, but we have a lot of vaccines in our community, and people are still having questions. What do you say to them about how to get the questions answered and what they should do with this opportunity now that we have?
So the first thing that I would say to people is the vaccine is a very important layer of protection in our turning the tides on this pandemic. It's not perfect. Nothing is, but it's very important. So all of the prevention measures that we talk about, like washing your hands and covering your cough and your sneeze, watching your distance, all of those things, avoiding large crowds, all of those things are things that are right in people's hands that they can do. And then we've got all of these other important governmental layers of protection. We've seen workplaces improve their air ventilation systems. We've, had laws in different states, requiring people to mask or limiting and restricting the number of people that can be inside of restaurants and things like that. There's been a push to encourage people to move events when possible to outdoors, and more seasonal weather has afforded us that opportunity. If we can manage to keep a lot of those basic prevention measures in place, that's what we did earlier in the pandemic to flatten the curve. And by flatten the curve, I mean get the numbers down and keep them down. We did that and had a lot of success with it. If people can stay the course with those things, and then we add the vaccine to that picture, it could potentially be the thing that will really tip the scales for us. Because the goal is prevention. We don't want people to get sick and have to recover or struggle, or as Dr. McDougle shared, have the unfortunate outcome of having to bury your partner or your spouse of 20 years, or one of your parents, or, a loved one. Our goal is to prevent people from getting sick in the first place. And that is what the vaccine is providing us, an opportunity to figure out re-engagement, right? Because our other prevention measures involve keeping your distance from people or covering your face. A mask, covers your face. I want to show off my beautiful smile, but I can't do that with a mask on. I got to really show it with my eyes. The vaccine is an important layer of protection that really does speak to prevention. I can't stress that enough. Prevention is the key here.
So Dr. McDougle, yes, please share.
And there's some incentives too. So if you're fully vaccinated, you can actually have a conversation with another person that's fully vaccinated. So it's not just, you don't necessarily even have to wear a mask, so if you're fully vaccinated, it gives you some liberties in regards to family members who are also fully vaccinated, but still taking precaution and so forth. So
thank you both for that, because I hear people so often say the vaccine isn't the end all to be all, so why should I get it? But you're saying it allows us some additional privileges now that we won't have if we're not vaccinated, but it also gives us the opportunity to get connected again to some of our families and friends. And we look forward to opportunities that you can learn more about what you can do to be safe during COVID.